And I just want to point out that we should never lose sight of the focus of these numbers. These numbers are from the middle of August, the total cases, the total deaths, and the total doses of vaccine. And I would like to emphasize that my country, Mexico, has one of the highest case fatality ratios in the world. And we also have the dubious honor of having the largest number of deaths in health profession workers due to COVID-19. I propose that we have this data always in the background of our minds whenever we talk about education in the present times, and they should also be in the forefront of our discussions, because this reality of the cold hard numbers of the pandemic, they are here and they are growing every day. And we have seen this mirror image of the light at the end of the tunnel with the vaccination process, but we still have a long way to go, as you can as you can see if you see the news every day during this second half of 2021. How we look at the world depends a lot on the personal, ontological, and epistemological beliefs. So the patterns of reality that we confront are very different depending on where is your starting point. So I would suggest that we try to embrace the whole spectrum of reality instead of going to the polar opposites. For example, as shown on the slide, there is this guy at the upper left-hand corner, and there's this person at the lower right-hand corner with very different views of reality. I would tend to embrace the Dr. Fauci, but we have to recognize that a large part of society agrees with the person that's on the bottom of the slide. So these realities that are different are the result of, as Dr. Kenneth Burke, one of the most famous experts on rhetoric, said, every way of seeing is also a way of not seeing. We tend to focus on our biases, our beliefs, and in the present culture of our times, it's very difficult to have reasonable conversations and to really reach consensus. I think that health professions education is this beautiful kaleidoscope of interacting systems. As you can see on the slide, we have this ecological system of learning, where on the one hand, you have the classrooms, the traditional classroom, the simulation centers, the laboratories, and the clinical wards or the medical offices. And one of the basic premises of learning, as shown on the slide, is this tacit assumption that everybody is more or less close to each other physically. And the pandemic has completely changed that paradigm. It has disrupted completely the practice of medicine, and it has also changed very profoundly medical education. So UNESCO said last year, this is from April of 2020, that the million-dollar question is if, under the assumption that teaching activities have continuity, that students will achieve the learning objectives of the curriculum. This is critically important because we have all these beautiful curriculums, and we have to transform them in activities that occur in real life and that generate deep learning in the students. And as I mentioned in this editorial in our journal, this is the Mexican Journal of Medical Education Research, the pandemic has basically made us feel lonely, fragmented, isolated. I would propose that we should really collaborate. We should share resources, because there is no way that a single medical school, a single country, a single university or hospital can provide all the resources that are needed for faculty and students to really transform health professions education. One of the main messages of this conference is that the majority of ideas about teaching and learning are not new. They have been here for many years, for centuries. The problem is that not everyone knows the old ideas. And tragically, you may know the old ideas that learning occurs in real life in realistic settings, that you have to do things to really learn them deeply, etc., etc. These ideas are, you might know them, but you may not apply them, which is one of the tragedies of our present times. And I would suggest also that the same goes for online teaching and assessment. We have a huge amount of information, of academic evidence, of published research about online teaching. Online teaching is not an innovation. It's not something new. We have been living with online teaching for several decades now. And there's a lot of quality publications about online learning, assessment, faculty development, and deep learning that we should really apply now. In the setting of the pandemic, it's paramount to use the published literature and combine it with our personal experience. This is from Hardens, the roles of the teacher. I would argue that the roles haven't changed. We still need to be facilitators, role models, information providers, resource developers, planners, assessors. The thing is that the context changed dramatically. So, for example, now, information provider, the teachers, the faculty, the practicing clinicians, we are just learning in real time about the pandemic. We learn at the same time as the residents, as the medical students, nursing students, because the research is being published every day. So information provider acquires a very different dimension during the pandemic. A very important one is also the role modeling. Role modeling during the pandemic has become a clear path to improve things. We have to model assertiveness, leadership, resiliency, all of these skills that help build better teams and improve the quality of medical care. So the thing is that, as Daphne Kohler, a professor of computer science of Stanford, said last year, she was the founder of Coursera, one of the massive open online courses companies. And in the annual meeting, she mentioned distance education begins in the third row. Think about it. We greatly overestimate how much learning occurred in the face-to-face scenarios before the pandemic. We have these fantasies that everything was perfect and learning was 100% beautiful, perfect quality. But the problem is that that was not true. The pandemic has really made us put our feet on the ground and recognize the deficiencies of the previous system. So we have to build a better system during the pandemic for the years to come. Another important message that I have for you is that good teaching may overcome a poor choice of technology, as Tony Bates from Canada said, but technology will never save bad teaching. It's critically important. Education and the science of education has to be at the forefront of our activities now. This image is from March 2020. This was our first class in the Masters in Health Professions Education program after the lockdown in the university. And please have a look at the faces of the students, at the sadness, the burnout. They felt tired, and we were just a couple of weeks into the pandemic. We are now a year and a half into the pandemic, but somehow we have moved to this. This is from the same group. This is this year in June, at the end of the course. I know they are happy because the course finished, but you can look at them. They seem like different people. We developed a resilience. We developed a series of skills and strategies to really improve learning. And I just want to point out that this past year, frankly, I feel that I learned more from the students what they did during the educational session, the synchronic and the asynchronous activities, that what I taught them, what they learned from me. This is a critical important distinction made by the pandemic. I think it has given students a chance to flourish, to grow, to collaborate with one another to produce better learning experiences. We have done several studies in our university to explore the challenges for transforming practice to distance education. This was from March in a sample of university students. And as you can see, the largest problems were technological and logistical. Logistical at the beginning was a complete nightmare, if you remember. But we also had a lot of pedagogical and didactical issues, and the socio-emotional issues started to grow during these initial phases of the pandemic. And time passes, we have done several studies, and this is a survey that we did at university just last June. We applied the questionnaires to more than 25,000 students that responded the complete questionnaires, and more than 2,400 faculty. As you can see on the slide, the golden bars are the students and the blue bars are the faculty. 38% of faculty felt that learning was better at this stage of the pandemic, June of 2021, compared to only 9% of the students. On the other hand, you can see that 63% of the students felt that learning was worse, compared only to 22% of faculty. This discrepancy in perception is an example of what I mentioned at the beginning. Everybody's living the pandemic in a different way, and the same phenomena is interpreted differently by the persons that live the experience. I am a firm believer in evidence-based education. I think that we should use published evidence to inform our decisions. Opinions are critically important, personal experience, anecdotes, etc. But we really have to move to the use of academic productivity to increase the quality of our teaching and learning. This is the best evidence medical education, is Cochrane Reviews, the most recent version. And as you can see, almost half of the published studies during this year are related to online learning. Almost 20% to simulation, 9% to assessment, and 6% to well-being and learner support, 4% telehealth, etc. As you can see, there are several areas, but the lion's share is online learning. And this is an example of a systematic review and meta-analysis comparing synchronous distance education versus traditional education for health sciences students. If you see the bottom of the slide, in the diamond of the truth of the meta-analysis, the standardized mean difference was 0. That is, there was no difference in learning for synchronous distance education versus traditional education in this review. And there's also this meta-analysis of comparing blended learning with traditional learning in medical education. As you can see on the left hand are the 56 studies, and if we magnify the result, the forest plot, you can see the standardized mean difference in knowledge is 1.07. This is a huge, important, statistically significant, educationally important difference in knowledge. What this means at the end of the day is that blended learning has to be really included in our curriculum. And I propose that we should explore learning losses, what's happening with our students. These are recent systematic review of learning loss during COVID. And as you can see, there's only 8 published papers about learning loss. Of these, only 2 of them were in higher education. The majority of the papers are related to kindergarten, basic, and primary school. So only 2 in higher education, 1 in the United States about economic courses in 4 universities with a decrease in 0.185 standard deviation of knowledge. But the other study is a fascinating study that I highly recommend that you have a look at it. It's from the Universidad Autónoma de Madrid in Spain. They explore the influence of COVID-19 confinement on students' performance in higher education, almost 500 students, 3 different topics, and they found that not only did they increase the scores in the testing, the examinations, but they also changed the pattern of learning. Instead of focusing only on the examinations, they actually distributed more evenly throughout the educational intervention during the course of several months. They studied more in more time. At the end of the day, they had a better scoring testing, but also better patterns of study. I think this study, I hope that there are more studies like this in the near future. We need to be optimistic about it. And technology, as you can see on the slide, has taken over our lives. Internet has become one of our main needs as humans, as the family. If the electricity goes out at your house, like in Mexico, it happens frequently, you are in a problem. All the family goes into alarm mode if you lose internet. The thing is that we have to use technology in a better way. We have to promote the concepts of biomedical informatics, clinical informatics, e-health, and include this in the curriculum. Almost 10 years ago, we developed this medical informatics course for medical students in a major curricular reform. And we did this from the very beginning. I mean, the whole curriculum design has to take into account the modality of blended learning in order to not just have it as something strange or imposed from outside. It has to be part of the curriculum. And we need also to include the telehealth competencies across the learning continuum. The pandemic has shown conclusively that telehealth is here to stay. And we also need to acknowledge the limitations of technology. This is Justin Reich, an expert in online learning from MIT. This beautiful book, I highly recommend it. It's why technology alone cannot change education, because if you see how we taught several centuries ago, how we taught at the beginning of last century, how we have been teaching in the past couple of decades before the pandemic, time and time again, systems domesticate technology. The hidden curriculum influences everything, customs, the usual way of doing things, and this huge pressure from the large technological companies to buy their products. So we tend to reproduce the traditional teaching using technology, and the end results can be something like shown on the slide, with this kid completely asleep during a Zoom conference. So we need to use educational and didactic principles in the use of all these beautiful technological tools. This is a beautiful book about it with a teacher from Harvard University. We recently published a review about the use of Zoom and the video conference platforms in health professions education, because they are just a medium. They influence greatly the process, but we have to focus on the educational aspects of the use of these technologies. And I just want to finish with this reflection about what is reality. There is a huge amount of research about the neural mechanisms to differentiate what is real from what is imaginary. I really think we need to explore these all these fields, neurobiological fields, and combine them with the use of everything we do in education. This is again a quote from Justin Reich. Everyone is having a different pandemic. For some young people, learning has gotten much, much worse. For others, the pandemic has been some of the best learning they have ever done. And I want to finish with this phrase from the Manifesto for Teaching Online. Don't succumb to campus envy. We are the campus. The human beings, the person that participate in the educational process, we are really the university. Thank you very much for your attention.
Thank you for this very interesting conference. Now we are going to go to the panel. We have here today Lilian Ferrer. She's Vice President for International Affairs. She's a nurse midwife from the Universidad Católica de Chile, and she has a PhD in public health sciences from the University of Illinois at Chicago. An institution from which she also obtained a Master of Science in Nursing. Her research and development areas have been mainly in the field of public health, community sciences, HIV, prevention, and global health. Welcome, Lillian. I will also introduce John Curnow. He's professor of biomedical education at University of Birmingham. He's also the director of education for the College of Medical and Dental Sciences. He's committed to research focused teaching at both and on the undergraduate and postgraduate level. So thank you very much for being here. And I have some questions for the panel for you. And of course, also Dr. Mendiola is going to join to the panel. And I have this first question. What are the impacts of the health profession educations in your local contents regarding culture, healthcare systems, economic situation, the topic that you want to address better from your context? And the order is going to be first Dr. Curnow, then Lilian, then Dr. Sánchez.
Thank you very much, and thank you for that fascinating presentation. I guess I'm slightly different from perhaps other people on the call. I'm not actually a healthcare professional. I'm actually a biomedical scientist, but in my role as Director of Education, I've had to coordinate all of the activities for our undergraduate and postgraduate students in all of our healthcare profession disciplines during the pandemic. So I've had quite a good insight into some of the challenges they have. Of course, in the UK, despite what they might think in this country, we've been very fortunate compared to some other parts of the world. We're still a very wealthy economy, and that's allowed us to do many things that certain countries aren't able to deliver. But the impact has been enormous. And whilst we have been successful in graduating our healthcare professionals to ensure that we have a stream going into the new workforce, it's fair to say that the staff teaching them have paid a fairly heavy price as they've gone on. In terms of the local context, I think the greatest challenge, and probably still the greatest challenge, is the disruption to the delivery of healthcare. In that, obviously, during the pandemic, the access that patients have to the health system is not what it was. They're not being seen in the same way. They're not being seen in the same time scale. So much of the resource had to go into looking after the acutely ill patients with COVID. And that meant for our students that they were really, well, almost bottom of the list, I have to say. I'm sure it was appropriate at the time, but we're still seeing an impact of that. So the healthcare system has yet to recover its position. We start to talk about post-pandemic. Of course, we're not quite there yet, but there's no doubt that we are doing relatively well now in terms of hospital admissions, but the whole system is now so behind. The waiting lists are longer than they have ever been, that there's still probably not the right amount of space for the education of our healthcare professionals when they're out on practice. So I think that's our biggest challenge locally as we go forward. We are substituting their learning with simulation more than we've ever done before. I think in the longer term, we will keep some of that, but I anticipate that it will primarily go back to that face-to-face education that they have when they're in clinics. So I think that's probably the greatest local context for us that's impacted on their education.
Thank you. So now we're going to address some questions from the perspective of Dr. Ferrer.
Yes, thank you very much. And I really appreciate the presentation that we had. It was really very important to see how there has been so many changes and actually we share similarities in terms of what has been going on in terms of increasing scores of the students and different things like that were presented. In terms of what has happened in the context and with clinical practices and the training of healthcare professionals, I would like to mention that in Chile, we have a mixed healthcare system. And the first thing that happened, and it was something totally different, and we had to somehow train our students immediately, we had to react very quickly, was the fact that all the different critical care beds and the care that was provided for patients with COVID was nationalized. So basically, regardless of being a private hospital or a public hospital, the beds were accounted for the country. So in a sense, it was a change of mindset that we all had to go through, and we had to bring our students that were taught in this mixed system to work as a national system. I would say that that was very important, and that meant that also we had to start thinking about providing the care that was needed. And in a moment where all clinical practices were canceled, particularly for undergrad students in their first 2 or 3 years. And then the older healthcare provider students, like for example, nursing in Chile, it's a 5-year program. Medicine, it's a 6-year undergrad program. So basically, in the last 2 years, they were actually providing care. So we had to be very creative in how to put together an internship that was offered quickly to our students and where they learned how to care for patients with COVID. So basically, in a sense, it was a way of reacting as a community, as a Chilean community. We had to provide an internship that was training students to get out very soon because we needed more healthcare professionals. And at the same time, we had to encounter the challenge of how to train the students in the first years. And here we have a similarity with what Dr. Carnell mentioned, and is the fact that we had to incorporate more simulation. Here in Chile, we used to have a model where we had, for example, for nurses, 2,500 hours of clinical practice. And now we cannot have that anymore. And the most likely, we're never going to be able to go back into that. So basically, there is a change of paradigm in terms of incorporating simulation more, incorporating technology, but totally being aware that technology is not enough. So basically, also, this time has been an opportunity to create another ways to have encounters between students and faculty members from different parts of the world, and generating these encounters that somehow trigger a network that afterwards could creatively work together in joint ways of teaching healthcare providers for the future, and also doing research around that area. So basically, I think that what has been mobilizing us here is that we needed to move really fast in order to have more healthcare providers. We didn't have a chance to stop training them, so we incorporated new strategies like simulation, but also we had to work with our partners in the clinical sites in developing these new models where interns actually had to go inside and start providing care for patients with COVID. So I think it has been really tough. We didn't know how to do it, but I think that we had the most important thing that has happened is that we have been working really closely, establishing interdisciplinary networks, networks with the clinical sites, and also networks with our international partners. And that has helped us maintaining the training of our healthcare providers. Thank you.
Thank you. So we are talking about an impact of the entire healthcare system, and this have changed things in order to move forward with more technology, assimilation, but also more network and collaboration in order to be reactive to the situation of COVID. Dr. Melchor Sánchez, What do you think about this from the perspective in Mexico?
Thank you, Sylvia. Well, first of all, it was a little creepy or awkward seeing myself. I have a lot of feedback for myself. I wrote down several things that I did badly educationally during the conference, but well, that's another issue. Well, that's an important thing that now we can actually do this. In other times, it was unthinkable to have recorded presentations in a conference. It was, I mean, in the pre-pandemic frame of mind, that just wasn't in our map, in our radar. So when we talk about impact, the word impact is very strong. And regarding healthcare, for me, it's this dichotomy of a medical emergency, like the pandemic where you can die. And in that emergency, priorities take over. I mean, education, for me, it has been fascinating to see that education has not been a priority in the same sense as health, which is understandable. I mean, if you are infected and you have pneumonia, you can die. But if you do not go to classes and do not learn anything for a month, nothing happens. I mean, you continue living and being part of society. So in that sense, I would like to talk about impact from in a systemic point of view, on the micro level, the meso level, and the macro level. In the micro level, the students in Mexico, it was a very strange experience that we actually took out of the hospitals of our students, the medical and the nursing students. It was a paradox because usually when you enter to study medicine, you are admitted to study medicine and nursing, you have this basic premise that you are there to help. And suddenly they tell you that you're actually getting in the way of providing good health. So we took out all our students from the hospitals, I know, to protect them, but it sent a very mixed message where there was a lot of ethical discussions in the media and the social networks. The residents stayed at the hospital. That was, if we had taken out the residents out of the hospital, the healthcare system would have collapsed. Residents are a critical part of the healthcare system in Mexico. And another part of the micro impact is in the individuals was the lockdown and the working from home and learning from home. That has basically changed how we view departmental meetings, educational sessions like the one we are doing now. In the meso level, I think that as Liliana and John have mentioned, the hospitals and the universities had a lot of impact. I mean, we have lived through that. The interesting thing is that the impact has been chronic. Last year, when we had the meeting with the president of the university and the deans of the faculties and schools of the university, we had this sense of an emergency, like an earthquake, like a tornado, like a tsunami. But as months passed, we have this chronic emergency. We haven't solved it. We still, as I showed on the initial slides of my conference, we still keep having almost more than 500 deaths every day, which shouldn't be normalized. But that's part of the landscape right now. So I think this dynamic impact still has to be professionally measured. We still have to need a clearer picture of the not learning loss. I hate the word learning loss because loss means that you lost it and you will never recover it. More researchers are preferring to use the word learning lag because there is this delay, and you didn't stop living during the pandemic. You actually, as John Dewey said, education is life itself. So by the mere fact of living in the hospital and taking care of patients, you continue learning. But so we didn't learn some things, but we learned another things, which in a sense, eventually things will be a little bit balanced. But we need a clear picture of what to do in terms of remediation to recover for this learning lag. And then the last part, the impact in the macro level, the systems. in this adaptive complex system that we live in. It's interesting how universities and hospitals are like still different cultures, different worlds. I hope that the pandemic teaches us to be more collaborative in a real sense, because leaders pay a lot of lip service to saying that we collaborate, etc. But at the end of the day, most of the people are on their own. So that's a critically important part. So, okay, I leave it there. Thank you.
Thank you. So it's chronic. It's a strong word, I think, but it's very similar to reality. I want to say that I was shocked by the huge gap among perception from students and faculty, the one that you showed at the conference, Dr. Melchor. I had sensed myself that faculty is now, okay, being at home and for some, of course, some courses and some theories. But what do you think, doctors, about these different mental models and different ways of thinking about distance learning and working and studying from home? What do you think? First, I go with Dr. Corno, then Dr. Ferrer, and then Dr. Sanchez.
So thank you. So interestingly for us, our government was rather brave, perhaps foolish, in removing all of our restrictions. And from next week, actually, all of our students will be coming back onto campus. All of our faculties will be back onto campus. We will have a very few number of staff who will continue to work from home because they themselves are vulnerable. So it's going to be a very interesting experiment, and we've had to move to a blended learning world where we've had to decide which elements we wanted to keep online because they're actually really good for the students, and then obviously bring everything back onto campus. So I think we're very rapidly trying to move back to a more pre-pandemic model that nonetheless retains some of those elements that might be beneficial. I was also interested by that graph showing a huge discrepancy between the academic staff and the students. I've heard that locally, actually. I had one, we were discussing this. I had a rather different view to the faculty member when we were talking about some of the teaching we were doing in my own discipline. And I said, well, so they wanted to leave them all online. And I said, well, we need to bring them back onto campus. And they said, but they learned just as well last year. They did really well. We've looked at all their exam results. They did really well. So why aren't we leaving it that way? The problem is that we forget how hard our students worked during the pandemic and continue to work. The social isolation left them with very little else to do. And we know that they committed far more hours of their lives to their education than they would ever do. I also don't think that's sustainable. We may come on to talk about mental health in a few minutes, but I don't think it's reasonable to expect our students to carry on working that hard for their own learning. And I still don't think the depth of understanding is really there. I think the fact that they did as well in their exams may just reflect the fact that the exams are not necessarily perfect measure in themselves. So I think there's many things we still have to consider as we go forward and not have too many assumptions. So apologies, I haven't really given many answers there, just more questions, but I think that's the nature of where we are at the moment.
Thank you. Right now, I would like to encourage our participants to share their comments and also questions for our panelists. Dr. Ferrer, what do you think about this, the perception from students and the gap of perceptions from the faculty?
Yes, thank you for the question, Silvia. And as John said, I think we're living in a moment where every day, every single moment, we have more questions, and it's really hard to find answers. But I would say that in the Chilean context, what has happened is that very early in the pandemic, March last year, we decided to close our campus. And actually, we didn't know what to do, honestly, and we decided to close it because we really wanted to care for our students and faculty members. We didn't know exactly what was going on. And at the same time, it was good that previously we had some online teaching devices and systems that were already in place. But basically, we went from face-to-face learning to remote learning and not necessarily online learning. So I think that while in the process and while developing these remote activities that were basically providing online synchronous teaching, we started developing other curriculums that were really thinking more about an online course. In the process, I think that the students were very tired, and they were all the time complaining about how frustrating it was for them, first of all, not to be able to socialize. And it didn't matter how we organized the online sessions, they felt that they needed to feel more close to the other students. And that was particularly important with first-year students. We still have first-year and second-year students that have been attending campus classes like 20% of their whole program. So basically, there is this frustration that they are going through a moment in life that they were waiting for to leave in terms of socializing. But at the same time, they feel very tired with these online, very long sessions. And at the same time, I think that one of the important issues that we had is that faculty members, sometimes we were not aware about how different those sessions had to be. So it was not just providing a remote synchronous lecture, there was something different behind. So basically we had students that were tired, faculty that were tired, and we had to implement pauses along the semester. So basically we provide faculty members, students, and the whole community weeks where it was considered like a recess, and we implemented something on Wednesdays afternoon that this was technological pause. So basically nobody could have Zoom meetings, online sessions, or things like that. So it was like giving this, how can I say, these messages about, we understand that you're tired, we're all in the same place. So we're gonna give you some time to relax so it's not so overwhelming. And at the moment, what has happened is that the students started liking staying home for certain courses and classes. They don't want to go back. We are back on campus with around 50% of our programs and courses, but a lot of the students, one of the comments that they are making now, it's like, you know what, we would like to have a hybrid session. So if I want to go, I attend classes. If not, I take them from home. But at the same time, they are really requesting and putting a lot of concern around how much practice they would like to get into. So basically, they want lectures to really stay in that mode, hybrid, basically, but that we have more time for going into clinical practice or doing simulation. So I think that if I can somehow put a name of this, I think we are in the process of adjusting and understanding what are the feelings and what are the needs that we all have. And we have been working really hard with all faculty members in terms of supporting them in the process, because basically this was not something that faculty were prepared for.
So what I understand, it's about the importance of actually giving value, both by online and on face-to-face. I mean, if I have to go to the campus, I want to have something valuable in change of that I do not receive as online learning. And I also understand that you said that it's important for everyone to adapt to this new hybrid model in order to give and receive what is the best of both worlds. Dr. Sánchez, what are your thoughts about this, the concerns of both the students and the faculty and the gaps around their concerns?
Yes, I think that students want more than the technical aspects of the profession, you see, because I am right now in charge of distance education for the whole university. So I have to deal with professors of poetry, cinematography, philosophy, nursing, veterinary medicine, etc. And in medicine, we are so focused on the technical aspects of things. Most of the curriculums in our country are still the traditional Flexnerian curriculum where you have these basic sciences and then they have these clinical segments in the programs. But the pandemic has really given the message that education is not just the technical aspect of a profession. And students want the whole enchilada, as we say in Mexico, the whole educational university experience. Lilian and John and yourself have mentioned the importance of socializing. I mean, if you are if you are 17, 18, 20 years old, and you are, I cannot imagine what it would be like for myself at 20 to be locked in a in a house with my parents, for example. And we have all these silver linings of living and working with the family, etc., which there are many positive things, but there are also the things that the students miss most. And that shows on the discrepancy that I showed on the slide, you see, because there is a lot of evidence that teachers have been using much more hours per week in the online modality than we did previously in the face-to-face modality, at least in our country, in our university. And the students complain a lot, and there's it also showed in our surveys that the teachers leave a lot of homework, a lot of readings, a lot of things to do, and a huge amount of synchronic sessions. I mean, I agree completely with Lilian that what happened was what many experts have called emergency remote teaching, not actually online learning. There was a lot of improvisation, a lot of everybody for himself, and you can do what you can with what you have, and with a lot of technological issues like we have in our country. So to have really quality distance learning, we have to move socially from this paradigm that distance learning is second rate, low quality, that you don't learn. The evidence is there that online learning and blended learning work. You just have to use it well. You have to design, as I mentioned in the conference, you have to use the basic educational principles that have been in place for many years, but actually use them, not just talk about them, but actually design the curriculums with these goals in mind. And we have to move to this mixed hybrid education model. We have to focus more on using the limited windows of time that the opportunities that we have for physical closeness. But my university is still closed. I mean, I am here in my office, but the university is mainly empty. We have only the administrative people here. The students are not coming to the university because they are not vaccinated yet, which is another catastrophe. I mean, I have no words to mention this asymmetry in the world, where we have countries, like many countries in Africa, that have basically no vaccines, and there are countries that have a lot of vaccines, but they do not want to use them, which is these paradoxes of humanity. I just wanted to mention a little bit the assessment part, because as John mentioned, we really need to reevaluate our assessments. One of my areas of expertise is in summative assessment. I am in charge of the admission exam to university. These multiple choice questions, highly standardized summative examinations that have a large impact on students, they haven't moved in the pandemic. Actually, the test scores in the last year in our university for the admission exam and the diagnostic exams, they didn't go down, but actually went up. But the socio-emotional issues, the health, mental issues have actually increased. And all the other things that are substantial elements of the learning experience are missing. So I think we should move a little bit from going back from the traditional assessment, more focused on summative end of course assessment, to a more assessment for learning, formative, with feedback during the whole educational intervention, which competency-based medical education is, I mean, we should really embrace that model all over the world, because it focuses more on what actually the professional can do, and not just on how much time you have been in the school. And we have this phenomenon also of grade inflation, mainly in higher education, and in the residencies, we usually inflate the grades. So everybody gets high grades. We should also migrate to this pass-fail schema that decreases this large, how do you say, when you fight for something, this competency among students to fight for the better scores, to get scholarships, etc., which actually dominates higher education, at least in my country right now. We should focus most on assessment for learning.
Thank you. So now what I hear, it's not only about the technical part, but it's also about the huge experience, the whole experience that university offers to students. I mean, we can manage some technical contents regarding distance learning or education, but the students still are missing something regarding the socialization and of course the clinical part experience and so on. So I also what I hear, it's about assessment, and what I understand, it's about the assessment should be not only also for technical aspects, but also for topics regarding mental health and other concerns that we already have, since the university is the whole experience, which should also address by assessment other things just around that. Right now, I would like to open microphones to everyone in the room. So maybe Ricardo may help us to unpin us so we can see the whole group, and open up the discussion so the rest of the participants can share with us their own concerns or their own experiences regarding the impact of the pandemic. And we can start a conversation. If you want, you can put your questions or comments in the chat, or you can open up the mic and share with us anything you want.
So if I could just maybe pose a question to everybody who's here.
Yes.
One area that really concerns us all is just how exhausted everybody is. Whether you're an educationalist or on the front line looking after patients, as has been mentioned, it's a chronic process now. It's gone on for so long. And I think we're all struggling to understand how we're ever going to emerge from this. And I'm not pretending that anything is near normal yet, but if we don't start thinking about how we're going to work and live post-pandemic, or as we come out of the pandemic, I fear for our own mental well-being. And I'm not an expert in this area at all. The only thing I'm trying to do is to re-empower people locally. So I think for us, what's happened during the pandemic is everything is now dictated to you. You can't make any decisions because you've got to wait for somebody else to tell you what has been decided centrally before you can enact it. And yet there's so much knowledge, expertise and energy locally. And I think the only thing I want to do is to say, no, look, you understand your business, you are the experts. Please, carry on as you would have done and get on with it at your own speed with your own workload. And that's all I can offer, I think, to everybody, but I'll be fascinated to hear other people's thoughts.
Dr. Valdez, you want to share something?
I want to ask a question, particular to Melchor. Hi, Melchor. Always good to see you. You mentioned that you were phrasing that we are the campus. How do we create this really sense of being the campus, being this community through these IT devices? How do we develop these skills, or more in the human side, with this online presence or these online activities? And I'm making the question to Melchor because he mentioned that, but Lillian and John, please, if you want to comment on that.
Okay, yes, that actually I have the book here, the Manifesto for Teaching Online from the University of Edinburgh. I love the book because it actually puts the finger on the wound about online learning, how the mainstream thinking is that online learning is second-rate, low quality, etc., and that there is just no way that you can compensate face-to-face learning with online modalities. So actually the manifesto is very interesting because it asks this hard question that have been like hidden from the mainstream online teaching community, because we should actually stop talking about online learning. I mean, learning is something that happens in the person, in the individual. So right now, most persons in the university have access to knowledge and wisdom and experiences is mediated by technology. Technology is like electricity, like water now, like the air that we breathe. So the message of the quotation from the book about that we are the campus is that we tend to focus too much on the buildings. We tend to focus too much on the institutions. And if a student graduates from the institution and is successful and becomes a very important person in the world, that's then the institution hangs the gold medal in its abstract chest. But if a student graduates and is a criminal, a murderer, or a sexual harasser, etc., then the university says nothing. So what I mean to say when we are the campus is that all the single individuals that work in an institution are important for the outcome of the whole institution. We should move away from the focus on the separation of the physical areas of learning to actually move to this more holistic model of learning landscape, where we have some things that happen in brick and mortar buildings, in laboratories and simulation centers, and in the online modalities. So I think that in order to try to answer your question, we should move to more quality online activities. I mean, for example, Randy Garrison model for online learning that has these three presences: the cognitive presence, the teaching presence. The cognitive presence is fundamental. You need to have this higher order thinking, critical thinking, intellectual discussions to learn, and also the teaching presence, which is why teachers are critically important. I mean, the teacher has to help the students to navigate the learning process, but also the emotional presence, the socio-emotional presence, which is, I mean, in the traditional vision of education in the face-to-face, the emotion was not under the radar of the model. So I think that we should incorporate more as I say, the evidence about online learning, that socio-emotional aspects of teaching can be successful incorporated in online teaching, and develop the thing. For example, we have students that haven't been in the campus for more than a year. So we can do several things. We can have short tours with small groups of people to actually go to the buildings and, wow, this is a beautiful building. I am part of this building. Or actually do high quality virtual tours of the buildings, which sometimes can be better in terms of what you see that just walking with a bunch of people and looking at walls. I mean, I know that's a long answer to say there's no clear answer for this. I highly recommend this because, as I know, massiveness is more than learning at scale. It also brings complexity and diversity. Okay, I'll stop there.
Thank you. Thank you. What I hear here, it's one topic for discussion about the never-ending situation that we have here that Dr. Kernel invites us to reflect on, and also about this reflection about the actual infrastructure and the meaning of learning. So this is a very important topic for us to share and discuss. I don't know if anyone else wants to step in. If you want to. Yeah.
I only would like to mention, Silvia, and I totally agree with Melchor with the two issues. I mean, one is the landscape for learning. And I would say that in that landscape, we need to incorporate these online moments. So basically, it's a landscape that it's a little bit different, and it goes beyond the definition that we had before the pandemic. And at the same time, and I think that it's the most important thing, that we need to get back to the basis and actually remember that we are, and honestly, I don't know how to exactly translate the words to English, but nosotros estamos formando personas. So it's not just training future professionals. We are actually supporting the formation. That's the exact word, but I'm not exactly sure if it sounds good in English, but it's the formation of persons, of individuals. If we do not take advantage of this time when we realize that it's not just important for a person to do a very good endoscope, but it's good that that person feels well, that it's empowered, and that will help that person treat the patients better in the future, I think that we have missed the opportunity. So in those terms, that supporting the development and advancement of emotional skills and these more areas of the human being that are more basic, I think it's something that we definitely should move into. And at some point, because of technology, because of so much specialization, I think we were losing that track. And this is an opportunity to get back to it.
Thank you. So quite a change, quite a reflections about what happened, and it's an ongoing situation that we are still there. We were talking about that it's, in this situation, it's different, but it's, my daughters, for example, said that it was the worst timing for them because they were seniors, one of the high school and the older one at the, well, junior high school and high school. And they said that this was the worst time for them. But also, if you talk to mothers who have, you know, scholar or nursery kids, they say that it's the worst time for them because, so I think it's the worst time for everyone. And of course, of the health science profession, it's the worst timing because they want to learn from the clinical part, and the clinical is, as you earlier said, several barriers in order for them to practice there. And we have changed to technology, simulation and everything. So right now, as a group, you know, U21 Health Sciences group, and since we are different universities from all around the world, what do you think that we should start working, talking, and doing research about in order for us to move forward and start to work in a different future? I hear about the importance of research about what is the effectiveness of the online learning, but also about, I hear about mental health issues and I hear about assessment concerns. So what do you think? How can we start to think about and think out loud about this situation? Here I have a comment. Oh. From Jose Antonio Diaz, landscape is being challenged and might undergo some sort of reshaping, but the learning ecosystem needs to be understood by students, teachers, and all stakeholders. The challenge is not minor. In clinical settings, a combination of online presence and physical presence might be a good example of a complex but more complete environment of the ecosystem. I don't know if Dr. Diaz, you want to open up discussion or share something else about this?
Good morning to everyone. Antonio Diaz, currently I try to help at the medical school as the head of the clinical sciences department here in Monterrey. One of the things we've tried to move forward during all of this last 18 months is having that particular mix of interaction between students among themselves and with teachers in the clinical setting, and as well with the online presence. I completely agree with Dr. Melchor regarding that the landscape is changing, but learning is learning. So we need to understand that while all of this is happening, we do need to move forward and do our best to accomplish this. Certainly enough in a clinical setting when you have students making rounds or in clinic or whatever, the chance of them interacting among themselves and comparing what's going on and what they're learning gives them a sense of completion and a sense of being in a university. It's not this, probably, I'm not sure if it's the same while they're doing some other type of activities within the campus, but in accordance with one of the other speakers, I do believe that having these chances does make a difference. And that's what we've seen so far within these 18 months. We do not have all of those papers and all of those experiences put into a nice orderly fashion. We're kind of working with that, but I think we're getting there. And I believe that everybody, and I'm talking about the different universities and parts of the different healthcare systems are going through the same thing. This is just some couple of ideas for reflection and discussion. Thanks for the opportunity.
Thank you, Dr. Diaz. I don't know if one of the panelists would like to comment about this.
I mean, I think that the whole online learning world is obviously a necessity still within many countries. I think what I would encourage, though, is as we get more and more opportunities to have that face-to-face interaction and the social learning that goes alongside it, that we make the most of those opportunities. We're really encouraging staff not to use face-to-face time for things that they could deliver really effectively online. We've had an interesting transition that we're trying to think about what we consider as what we call core content. So that's really the sort of factual learning versus the application of that knowledge and how that's applied in context. And we realized that the core learning, the core content delivered online, either as a pre-recorded lecture as we've been using here or as a live lecture, is actually no different really from a textbook. It is just a video version of a textbook. Well, we don't really need students on campus to deliver that. So we've tried to start, it's really the beginning of a process here, is to define what that core content might be, allow the students to look at that before they come onto campus, so that we make the most of the time that we have with them, and actually reduce the amount of core content. I think we're probably all guilty of teaching far too much content within our lectures. What's important is the base knowledge and then application of that knowledge. So if we can reserve our time on campus for that, I think we really will begin to make progress, and therefore have that blended world that is as effective as it can be.
Thank you very much, Dr. Bruno. Here we have from Mariana Cordero a comment. Great discussion. Thank you very much. Could the pandemic academic crisis be an opportunity to address the relevance of well-being and mental health of students, residents, and faculty, and how? Thank you. I don't know if one of the panelists would like to share their thoughts in this question.
Well, we have to recognize that if burnout was something that we could see, it would be on the front of our faces of most of us. This is critically important. I remember a few days ago talking with another person about compassion fatigue. The difference in perspective. You remember last year when we were in the middle of the pandemic, in the first few months, physicians, nurses, and healthcare workers were like the heroes of the world. I mean, people clapped in the balconies and everybody sang, and they act like if you were the most important being in the universe. But right now, that thing has changed with the anti-vaccine movement, with the rejection of, I mean, I work in pediatric intensive care for many years, and many of my colleagues in the United States and Canada are right now, they have their intensive care units completely full of people that are dying because they didn't get the vaccine. So, and they actually are aggressive with the physicians and the nurses, and they have this, what they call compassion fatigue, that they are tired of giving everything and not worrying about themselves mentally and biologically. So I think this is a critical important issue that has to be addressed by the individuals. Everybody, each one of us has to worry about their own mental and physical health, but also the organization, they have to provide. I mean, there are several faculty development activities that can help people to recover, or at least to address the well-being and the mental health of our students and ourselves. But this should be on the radar of our scheduled activities for every day.
Thank you very much. We are on time right now. I want to thank you, all the panelists, for being today to share with us your extensive experience in the topic of health professions education and all the impact and transitions to this online learning, hybrid learning, and all in between. And I would like to invite all our participants to the rest of activities that we are having today. We are having a cultural activity of healthy Mexican cuisine. We would like to share with you a little bit of our country today from the people of Tecnológico Monterrey. We want also to invite you to the discipline groups that you are already registered. And of course, we have on later today, I don't know what to say in the afternoon, it's afternoon for Mexico, but I don't know the rest of the countries. We have the Teaching Excellence Award, and of course, this is an iconic event in this U21 Health Sciences Group Annual Meeting 2021. Thank you, everyone. Good morning, good afternoon, and good evening. And continue to our agenda today. Thank you.
Thank you.